Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase a microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. In today's video, I wanted to give you guys another update on Kintor Pharmaceuticals KX-826, also known as Pyrilutamide, which is a topical non-steroidal anti-androgen that is currently undergoing phase 3 clinical trials in China. It is expected to be completed sometime later this year. This means that if all goes well without any hiccups, we can expect commercialization. And finally, to have the opportunity to purchase this topical anti-androgen in China. Hopefully as soon as 2023. I'm not exactly sure how expeditious China's FDA approval process is, but the US is also undergoing phase 2 clinical trials on Pyrilutamide, so hopefully, fingers crossed, we will also get some good results from it. In my last video on Kintor Pharma, I gave an update stating that the highly anticipated phase 2 clinical trials that were already completed in China were to be released sometime this month in June. But unfortunately, this is yet again being pushed back to September 2022. And it really is a bummer because so many people, including myself, were waiting for an update. But according to Kintor, the reason behind this postponement is due to a recent increase in cases of a certain flu strain in China. So until they are able to, contain this pandemic and sort things out, it sounds like they are not going to be able to post up any of their phase 2 clinical trial results. This is absurd and crazy because, it's now almost been like a full year since they announced that phase 2 clinical trials were successfully completed as of September of 2021. And honestly speaking, I really don't even know of any other hair loss companies that delayed this long in publishing their clinical trial results. Most companies would publish the results, whether good or bad, in a relatively short period of time, in a timely manner after completion of the trial. But for some strange reason with Kintor, they just have been delaying it over and over again. And it's not like they don't have the data in hand, and they've already, been green-lighted to proceed with phase 3 clinical trials in China. So I really don't know why it's so difficult for them to just announce the findings. They've literally had a whole freaking year to compile a data spreadsheet, upload it to their website, and share it with their stakeholders. But it looks like we are, unfortunately at their mercy yet once again, and we are going to have to wait until September at the earliest. And this too can unfortunately be pushed back further to a later date. Hopefully that doesn't happen. But what's funny is that even if they do release their phase 2 clinical trial results in September, they'll already have been done and completed with phase 3 clinical trials by then. And that too is obviously going to have to be published at a later date. Things actually get more interesting. Apparently there was an image circulating on Discord groups and on Reddit with a potential screenshot from a presentation of Kintor showing phase 2 clinical trial results of 2.5 and 5 milligram Pyrilutamide. I can't say how legitimate this is, but I find it difficult that someone would want to fabricate and post up BS on phase 2 clinical trial results, especially if they have no incentive doing so. So I'm going to give them the benefit of the doubt and assume that this is indeed the leaked phase 2 clinical trial results that we have all been waiting for. So the presentation is titled Baseline Characteristics and Efficacy Analysis. And on the far left-hand side, you guys can see that we have the mean age, which is around 35 years. And let me remind you that this was for 120 male subjects initially. We can also see the BMI, and they also categorized those who smoked, those who didn't smoke. I'm not really sure how relevant this information would be. And then on the last column has the severity of androgen alopecia. Those who were between a normal 3 vertex all the way up to a normal 5 were the ones being tested in this phase 2 clinical trial. Now the column on the right side shows the efficacy analysis change from baseline at week 24 in non-vellus target area hair count. I will note that the study did not specify what the target area hair count is measured in, but I think it's safe to assume that the target area is most likely 1 centimeter squared, as most studies are measured by 1 centimeter squared when calculating hair count in this magnitude. So after 24 weeks, 2.5 milligram twice a day pyrilutamide yielded an average of 14.75 hairs per centimeter squared. 5 milligram of pyrilutamide yielded about 22.73 hairs. And then as you guys can see, we have the placebo, which had resulted in 9.43 hairs. This means that there was a difference of about 5 hairs between placebo for 2.5 milligrams and 12 hairs between placebo and the 5 milligram dose. In conclusion, change from baseline at week 24 in total area hair count of KX-826 pyrilutamide 5 milligram twice a day had statistically significant increase than the placebo group. So just for reference, 0.25% topical finasteride and 1 milligram oral finasteride yielded roughly a target area hair count of about 20 hairs per centimeter squared in 24 weeks. Probably a bit less if you count for the difference in placebo as well. 0.5 milligram oral dutasteride, which is known to be more efficacious than finasteride, and based on a few available studies that I was able to find, dutasteride roughly increased anywhere from 20 to 23 hairs per centimeter squared from baseline to 24 weeks. I will say that these target area hair counts increases per centimeter squared is going to slightly vary depending on the study that you're referencing, but in the grand scheme of things, the results from phase 2 clinical trials of pyrilutamide is looking pretty optimistic. It's almost as comparable to that of finasteride and dutasteride, and it might potentially be even better. We obviously have to wait until the official phase 2 clinical trial results from Kintor are released. But if the presentation is indeed what the actual results were from phase 2 clinical trials, pyrilutamide is going to be another incredible hair loss treatment regimen that we can incorporate into our hair loss treatment stack. Another thing to add is that these are results from 24 weeks. There's a good possibility, just like finasteride and dutasteride, that pyrilutamide can have a more efficacious result after long-term use. So this is also something that we need to keep an eye out for. Pyrilutamide works in a different mechanism of action by directly blocking the androgens from binding to the androgen receptors, as opposed to fluctuating the hormonal profile like it does with 5-AR inhibitors. So I am optimistic that adding a topical anti-androgen on top of a 5-AR inhibitor and minoxidil is going to greatly help stabilize further progression of hair loss with the potential to promote new hair growth. Pyrilutamide has shown to have a good safety profile without any adverse side effects, and because it is being applied topically as opposed to oral ingestion, I feel that there likely will be very minimal side effects, as it does not get metabolized by the liver and minimizes going systemic. People who are currently not able to take FDA-approved hair loss medications like finasteride or dutasteride, for whatever reason, whether it be side effects, sexual dysfunction, or fear of taking it, will potentially have an alternative medication to take. So I'm really looking forward to the commercialization of KX-826. I'm really excited about phase 2 clinical trials, also phase 3 clinical trials, and the results. And like I mentioned before, this is by far one of my most favorite anti-androgens that is currently in the research pipelines. I really hope that it pulls through, and fingers crossed, hopefully as early as 2023, we will finally have another hair loss treatment that we can incorporate into our hair loss treatment regimen. Kintor has been really good as far as meeting endpoints with their studies. So I am fairly optimistic about this company. I will keep you guys updated as soon as I get more information. But that wraps up this video, guys. Thanks for watching. Let me know in the comment section below what you think about pyrilutamide and the possibility of this leaked phase 2 clinical trial results. Also, if you guys have any questions pertaining to hair loss or hair loss treatments, I also hold one-on-one consultations. You guys can visit my website at hairliciously.com and book your consultation there. But that wraps up this video, guys. Thanks for watching, and I will keep you guys posted in my next video. Take care.